Hi, it's Dr. Casoni. Today I'm going to talk about breast implant illness. Okay, before we get into this topic, we have to cover some basics about autoimmune disease. Now, with autoimmune diseases, there are a lot of different categories, a lot of different parts of the body that autoimmune conditions can affect. And there's also a lot of different causative factors to consider when treating an autoimmune case. Now, the basics are going to be that the body has reached a point where it is highly reactive, it is overreactive, and it is also confused. Now, this can be from some immune response. This can be from a chemical exposure, could be from leaky gut, can be from any number of things. So let's say, for example, that we work in a chemical factory and we're dealing with the exposure to chemicals. Our barrier, our skin is keeping those out. But as they get in through our skin, through breathing, through ingestion, these chemicals, as an example, end up in our bloodstream. Well, next, the liver is going to have to deal with these and try to neutralize them and then excrete them out through the urine or feces. However, there's a point where that liver is overwhelmed and can no longer decontaminate the blood. And what we get is these chemical contaminants, in this example of the chemical factory, all throughout the body. And that's going to cause the confusion. That's going to cause what we might call intracellular signaling errors. The body can't regulate all of these reactions going on throughout the body, so it becomes hyperreactive and confused. And in that state, we're still not autoimmune. That might be like the fibromyalgia patient who is swollen and achy and fatigued because their body is fighting a battle. They're going to the store, but their body is confused and fighting this battle. So it's a real state with a real set of symptoms, although most doctors are considering it a non-diagnosis. Well, it really is just a description of symptoms with no cause that's investigated if you're in conventional care. Nonetheless, I want you to think of fibromyalgia as pre-autoimmune, because what it takes to get into autoimmune is some dead tissue. In that confused state, let's say the person goes for a hike, stubs their toe, and that joint capsule that's damaged from stubbing their toe has some dead tissue. Normally, their body can handle that. And normally, the body is going to metabolize any necrotic or dead tissue and then repair the damage. However, in this hyper-reactive, hyper-inflamed state, the body's confused and attacks that dead tissue. And so the person stubs their toe and they wake up the next day and 5 things hurt. And they go to the doctor and they're diagnosed with rheumatoid arthritis or reactive autoimmune arthritis, something like that. So that's the mechanism. The other possibility is there's a state of decay internally because there's poor blood flow and inflammation, and you have the same mess, but maybe the thyroid, for example, is not working very well and goes into a state of decay and releases some dead tissue. Same thing can happen there. And now we wake up with a Hashimoto's or a Graves presentation, which is autoimmune thyroid case. So either way, we have that overwhelm, hyperreaction, and confusion systemically. That's the point. So when we get into breast implant illness, we have to consider that going on. Now, here are the 4 patient categories that I've observed relating to breast implant illness. Okay, category number 1. This is the person who gets the implants and there is an immediate localized reaction. At the site of the implant, it is red and swollen. This is not breast implant disease. This is basically something that happened during the surgery. Either an infection got in, which can happen, that is a surgical risk, or maybe they cut something or tightened up something that's a little bit too aggressive. And so oftentimes this is a unilateral or one-sided presentation, and you have the reaction at the local site of the implant. And this typically is resolved with secondary surgery that needs to clean it up, whatever that is. Whatever's going on in there needs to be looked at and investigated and cleaned up. And this type of phenomenon is pretty common. Now, the second category is going to be somebody like what we just mentioned in the chemical factory example. They're basically swollen, maybe they've gained weight, they're irritated, as so many of us are, because our modern day food supply and we have chemical exposures all over the place. We've had exposures to spike protein, which, if you watched my video on the 5 stages, spike protein from COVID goes through the body, causing irritation, much like the chemicals I mentioned. And so that can be a setup for autoimmune. But nonetheless, you have this person who's been heading towards that hyperreactive, confused systemic state, and they go to get their implants. And then upon having the implants for the next couple months, they feel worse and worse. And so they get on Facebook and they read some one-liners in groups about breast implant illness. And you'll see people who had their explantation surgery. So the implants were removed and they feel better. And it's cautious when you read stuff like this, because you don't know the whole picture or what that person went through. Maybe they're changing their mindset, their diet, they've gone to a holistic doctor. What we see is one fragment of what they're experiencing out of context, and then people want to make decisions. But we have to entertain the possibility that if they're having an autoimmune-like reaction post-implant, that it could be actually from the surgery. The surgery itself is cutting the body and flooding the body with dead necrotic tissue. Normally, the body can handle it. But if their body is already in that very sensitive, overreactive, confused state, then the surgery itself can be the triggering event. And indeed, they are in like a soft tissue, inflamed, autoimmune state. But this means that explantation surgery, which will also kick up a lot of necrotic debris, can cause a worsening of the symptoms because they're already confused and they're already irritated. The last thing we need is another surgery. So in that case, there's caution. Work with us. Let's get you better. Let's clean up the mess as much as we can so that you're prepared to get the surgery and it's successful without any aggravating flare-up. That would be ideal. Okay. So category number 3, this is the female who maybe had implants a decade ago or a dozen years ago and is starting to feel sick. And they are also maybe feeling sick because, like the modern day person, we're bombarded with bad food and bad thoughts, and we're all swollen and irritated and achy. That's kind of common nowadays, but they're thinking it could be their breasts. It might not. It could just be that they're one of the rest of us. I certainly have had a lot of these symptoms when I had gut issues. I was swollen and achy, but really I had to fix my gut. But nonetheless, they're reading the Facebook posts and they're thinking, I've got to get the breasts out. And maybe after that amount of time, they should be at least looked at, because there's a lot of problems with breast implants. They can leak and they can cause infections that even can be, they find mold. They find all kinds of weird problems when they remove breast implants that have been there too long without an updated replacement or surgery. So nonetheless, it's reasonable to think, but they go in and there could be some of these other infections that are driving it. Like I said, in this category number 3, it could be unrelated to the implant, or it could be that there is something with a bad implant or leakage. And so yet again, I still caution, we should prepare the body, make sure that we're supporting the liver, looking for any other complicating factor like gut issues or post-COVID blood stasis. The last thing you want is to go under the knife when you're still having some of that remnant blood damage from spike. Nonetheless, category number 3 has both a patient that really is needing to get their implants removed, and also has the patient who has had the implants and it might not be related. And we still want to make sure we're cleaning things up as best as we can before going under the knife. Okay, so the 4th category of patient would be the person who gets the implant and they don't feel good after getting the implant. They weren't really in that first or second category, where they were fibromyalgia, they were swollen and achy. They really had no health complaints. They were perfectly healthy. They get the implants. It's not a localized effect. It's a systemic effect. And it really does fit the Facebook post where this person gets their implants removed. That's the explantation surgery. And they just simply feel better immediately. That does happen too. Now, just to be clear, it's still a risk. We want to prepare the body, make sure that there aren't other things going on. But I have observed that that fourth patient category does exist. I don't see it as the main example of this. I see really the other ones more commonly, and that holistic care prior to explantation is a much better route. However, I have observed this fourth category where they didn't need anything. They just needed those implants to be removed, and their health returns back immediately, and they're better, and all systems go. Anyways, it's always best to think through things. And when in doubt, take a look at the holistic approach. See somebody like our team or another holistic professional, because we have a million diseases, but there's only about 10 systems. We want to make sure that the systems are working as good as they can. That's optimal function, because really holistically, the sum total of all of our systems working the way they're supposed to is going to be health overall in every single area as well. I hope you enjoyed this talk. Take care. More to come. Enjoy your day. Bye.